Hello and a very good evening to all our viewers who are joining me live in this interaction on Facebook and YouTube as well. So with each passing day, we come across new details about COVID-19 emerging out of somewhere or the other. So you might be wondering what the buzz is all about today surrounding COVID-19. Well, if I have to tell you, a team of researchers from the Children's National Hospital in the US has found that COVID-19 and the antibodies can coexist in patients. And these researchers also wanted to understand as to how long it takes for the patients with the virus to clear it from their systems and at what point they start to make antibodies against COVID-19. So the research is on, and meanwhile, neutralizing antibodies, like the researchers found, are important in potentially protecting a person from reinfection of the same virus. And this study was used as a retrospective analysis of 6,369 children who had tested positive for COVID-19 and the virus that causes COVID-19, and 215 patients who underwent the antibody testing at Children's National Hospital or Center between March 13th, 2020 and June 21st, 2020. Out of these 215 patients, 33 had co-testing for both the virus as well as the antibodies during their disease course. So 9 of the 33 showed the presence of antibodies in their blood, while also later testing positive for the virus. Now, when I spoke about virus and antibodies coexisting in children, you might wonder how. And in order to answer this particular question, we have with us Dr. Sitesh Roy joining us live in this interaction. Many thanks for joining me in this live interaction, Dr. Sitesh. And my first question is, does this mean that the children still have the potential, the potency to transmit the virus if antibodies are detected in their body, doctor?
So Deepak, what ends up happening in these situations is that while our body is warding off or fighting the virus and it starts making antibodies, we can't expect that the antibodies will be successful in clearing the virus altogether at one shot. It's a process that also takes a couple of days. And hence, at a certain stage in any infection, including in the COVID-19 infection, we can expect that in some children or even in adults, there can be an overlap between the antibodies being detected and the virus being still detected. The general rule has been in adults that the shedding of the virus, where an adult can spread it to another human being, occurs for about 10 days after onset of symptoms. This is in the mild to moderate adult cases of COVID-19. In the severe cases, the shedding can go on for up to 20 days after the onset of symptoms. That's because possibly the immune system is not effectively clearing it or is over-responding in a wrong way and hence not being able to clear it. But in kids, it turns out, though they don't have severe illness generally, they also can have the virus and the antibody coexisting, which can make the screening tests that are available a little bit more confusing in case of kids, and also make the chances of kids transmitting the virus a little bit higher.
Also, doctor, now when when the researchers said that the antibodies and also the virus coexist, how is this possible?
So what ends up happening during an infection is when the virus first enters the body, for the first 3 to 5 days, the body a process called our innate immune response.
Okay.
In the innate immune response, there are a variety of cells called macrophages, dendritic cells, natural killer cells, which try to ward off the virus. In some cases, it is successful in doing that, and those may be the people who have asymptomatic infection. In some people in whom the virus cannot be fought off by the innate immune system, by between day 3 to 5, an antibody called IgM starts to get prepared by the body, and subsequently it class switches to something called IgG antibodies, which start at around day 7 to 10 and peak around 3 weeks. Now, this IgG antibody is what is being detected on most of the tests that are being done for antibody screening for COVID-19. So as we can expect, between day 10 and 21, assuming the usual data that is there for adults, we would not expect the virus to be detected. But even in adults, it has been seen that there have been people who have shed the virus for up to 25 days after onset of infection and symptoms. So I think the same is true for these 9 children out of 33, where they were still having the virus shedding. The antibodies were also still being in the formative phases and being detected, but it wasn't completely cleared. Also, we have to remember that detecting the virus on an RT PCR or an antigen test does not necessarily mean that that child is still infectious and can pass it to other people, but that is an area of research going on to know whether the particles that are being detected by these tests are actually capable of causing further infection to further individuals. I am also not surprised that children are behaving this way, because children are known to mount a slower but more effective immune response. And that is one of the reasons why children have not been seen to go into cytokine storms or other such complications that occur due to an overzealous and over-enthusiastic immune response of the body.
Also, doctor, now my third question to you is, do antibodies correlate with immunity, and how long does the potential protection and antibodies last, after reinfection?
This is a very, very important question, Deepak, and unfortunately, having antibodies does not always correlate with having immunity, though generally it does, but not always. The reason being, the quality of the antibodies and the nature of the antibodies are very important. So if a person has what is called neutralizing antibodies, those are the ones that would immobilize a virus or the cells that are carrying the virus in the body and make them or remove them from the system, not let them propagate or progress with the infection. And testing for the antibodies is not a confirmation that those are neutralizing antibodies. In order to check for neutralizing antibodies, you need specialized testing, which is not done routinely in labs. It is more of a research protocol. So far, however, we can assume that at least for the 3 to 4 months after an infection, based on data that we have from previous coronaviruses or old coronaviruses, that a person should have decently good antibody levels and decently good protection. This may extend up to 6 months or longer. But beyond that, even if the antibodies are present, whether they will be adequate and whether they will be all of the neutralizing type is an area of research that is still going on. And hence, my mention and my suggestion to our patients, our viewers anywhere, is that even if you have had the infection, you still need to take all the precautions, wear your face mask when you're around people, avoid crowds and gatherings, do hand washing, do physical distancing, and take all the precautions. Don't assume that because you've had the infection and you have antibodies that you're completely safe and protected, though in majority of cases you will be.
Right, that was Dr. Sitesh Roy who gave us his insights, and also about how the antibodies and also the viruses coexist in children. Now, although there is emerging data regarding this timing in adults with COVID-19, there is far less data when it comes to the pediatric population, and the findings that were being gathered by the children's national researchers and also the scientists around the world are also very critical to helping understand the unique impact on children and their role in viral transmission as well. So now that you guys know that viruses and the antibodies can coexist in children without even showing signs of infection, that doesn't mean that we should let our guard down and let our kids, or rather kids in our society, go out to hotspots, be it to a friend's house or a ground to play or even a tutorial. So with this, by keeping this in your mind, it is our responsibility, like the doctor said, you should always maintain good hand hygiene and also wear a mask at all times, especially when you're stepping out, because having antibodies doesn't mean that you are completely protected from the virus, the antibodies may even wane away. So in such a scenario, you might get infected by COVID-19. So stay safe and also follow all the safety and precautionary measures, because that is the only thing that will help us fight and also defeat COVID-19. With that, it's a wrap on this live interaction. Until next time, also take care and stay safe. Thank you for watching.